Kia ora, I'm Judith Huppy and I'm the Associate Clinical Nurse Manager for Ward 2. So basically that means I'm your go-to person. I coordinate the day-to-day running of the ward. That's with the patients and the families, the nursing staff and our multidisciplinary team and the doctors, and just ensure that everything runs smoothly.
Well, we settle you into your bed, give you one of these welcome packs, which has a bit of light reading, some colouring, a toothbrush and toothpaste, and give you a bit of an orientation around the ward. Show you where the toilets, bathroom.
It's often fun and it's the best place to be, to make you better. The nurses are not going to hurt the children. They shouldn't feel scared. All you do is you press your buzzer.
Yeah, hi, I'm Lynette Tiahu and I'm the Clinical Nurse Manager for Ward 2, the Children's Ward, and also the Special Care Baby Unit. My role here is to oversee and manage both areas, and that's really not on the day-to-day running of the floor, but just the overseeing and the budgeting and financial sort of implications, strategic planning, and also to step onto the floor when we're really busy during the winter periods.
Kia ora, I'm Joe. I'm a healthcare assistant on Ward 2 and I assist with the meals, I assist the nurses in the cares, and I make sure that everything runs smoothly.
Kia ora, I'm Ehi Pera Painting, I'm from Ngāpuhi. I'm a paediatric doctor here at Whangarei Hospital. Part of my daily work is looking after sick children that come into the emergency department, looking after our children on Ward 2 when they become unwell, and also looking after our babies in the Special Care Baby Unit, mostly newborn babies that need some special attention.
Kia ora tātou, ko te ahuau te maunga, ko tautoka te urupā, ko Ngāti he neira te uritani whā ara ko te popoto aku hapu, ko Cameron Moriwai tōku ingoa. My name is Cameron and I work on Ward 2 as the Takawanga Maori Liaison Officer. And my role is to look at cultural support pathways for whānau that come in, that are admitted into Ward 2. And the other part of my role is to support my colleagues, other staff on Ward 2.
Hi, I'm Leanne. I'm the paediatric social worker for Ward 2. My role is around supporting and assisting families, and I do things like work and income, Housing New Zealand, different agency services that are in the community that you might have support of. I'm here to guide you with processes or anything that you might be unsure of. Don't hesitate to flag me down. Ask any of the staff to find me and I can pop back in and see you.
Hello, my name is Rose and I am one of 5 play specialists that work on Ward 2. At the moment you can see I'm sitting at the Play-Doh table within the playroom environment. The purpose of the playroom is to create an environment that the children can come to from their beds that is not a foreign place. It's a place where there is something familiar, whether it be the Play-Doh, whether it be the computers, whether it be the drawing or the books.
For me personally, I think it's important that we provide a really good service, a top-notch service, and that we provide a really family-centred environment and it's holistic, and we include the family and the care. Also that we provide a really nice working environment for the staff, so that everybody's happy. It's a children's ward. Although they're sick, we want to provide a positive healing environment.
Some of the other things I do are supporting around accommodation and transport when families are struggling, not necessarily just to our hospital but also down to other hospitals such as Starship.
So my role is to sit down with whānau, to introduce my takawanga role, to look at services that might be appropriate to our whānau Māori. So I get an opportunity to talk about community services, iwi, hauora providers that may have an interest in their pathway while they're here.
Part of my role is to make sure that children who come in are immunised, and if they're not, we can do those here on the ward for you. Immunisation is important because we see a lot of kids come in with preventable diseases such as pertussis and things like that, that if they'd had their immunisations, these could have been prevented. So when children are here, we like to check that they're living in nice, warm, healthy homes and that their homes are insulated, especially in our respiratory children who come in with respiratory illnesses. If they're not, we can refer them on to healthy homes who can help them get free insulation or subsidised insulation into their homes.
Find us if you need resources. Find us if your child's about to have a procedure. We can come in with you and we can help give that child some distraction techniques or provide distraction with bubbles and things like that. Come and find us if your child's about to go to theatre, and we've got a really cool theatre book that actually shows you what it looks like downstairs. So not only is it the child that we're prepping, but also the parents. Come and find us if you're bored. Come and find us if you've got any questions, because if we can't answer them, then we can direct you to the right people that can answer them for you.
So we open the acute assessment unit in winter due to the fact there's a lot more sicker children during winter, or more acute, and also more numbers, to stop them really needing to wait for hours in ED. If they're very unwell and needing I suppose, very acute care, of course they go through ED first. If they're stable enough, they will come to the acute assessment unit to be seen by our paediatric doctors, first by a nurse and then by a house officer, and following that by a registrar or paediatrician. That really is because then they're getting a specialist seeing the child, so a specialist in paediatric medicine seeing the child rather than an ED consultant. Also in winter, ED is a very busy place and it's full of a lot of adult bugs which we don't want our children to get, so we like them to come to the acute assessment unit. To come to the acute assessment unit, however, you need to be referred, so either by your GP, your midwife, or through ED. So either of those areas, and then our doctors will see you here on the ward rather than actually in ED.
On Ward 2 we do bedside handover, so from the morning shift to the afternoon shift, so that we're involving the family in the care so that they are up to date with what the plan is. We also hand over like the charts, what we've given in terms of medication and our observations. We also, it gives the nurse the opportunity to meet the family and to be able to physically assess the child before they go and read their notes. And so it's about safety, it's about being family centred and keeping the family informed of their care.
So if they're a patient on the ward, we're happy to talk to them if they have any questions, and they can just ask the nurse to speak to one of us. If they're a patient in the community, the best way is to talk to their GP, and they can have direct contact with us by giving us a phone call. And that's probably the best way to get in contact with us if they ever need a hand.
For me, it's about patient first. I'm always striving to better our services in order for the patient to get the right cares in a good amount of time.
Anybody can feedback to any of our staff members, nurses, doctors, play therapists, healthcare assistants. If they wish to see me or Judith Happy at any time, we're really available. We're very approachable, really interested in feedback from parents and families that visit our ward and what we can do better. They can also fill out a purple form, which is a feedback for compliments as well as some concerns if they have any at all. Always our compliments outweigh our concerns, which is great for our ward.